So I think it's true to say that there's no such patient as the typical reflux patient. Patients are also different and they can present in a whole host of different ways. So as a consequence of that, they very often go to see a whole host of different doctors. They get referred to see ENT surgeons, sometimes gastroenterologists, backwards and forwards to see their GP, and frequently are given ever-increasing doses of antacid tablets, which in only 25% of patients will drugs like omeprazole actually work. So these patients are often really frustrated. Their symptoms can really affect their quality of life. So that's one of the reasons why we have the approach that we've got to the diagnosis of all patients with reflux, which involves a multidisciplinary team, including ear, nose and throat specialists. And that usually allows us to identify a clear diagnosis. And we know that in those patients who definitely have reflux and in whom we can't find an alternative treatment, and in particularly where the PPIs don't work, we now know that we can treat many of these patients successfully with minimally invasive LINX surgery with a good confidence of success.
Hi, I'm James. I'm 35 years old. I live in London and I work in property. So my symptoms first started when I was a teenager. I started getting acid reflux, heartburn. I had an endoscopy then, and this was followed up by 2 further endoscopies in my 20s and 30s. My symptoms seemed to get progressively worse over time, with some regurgitation, further heartburn, really struggling with some foods. I got put on PPIs, proton pump inhibitors, about 7 or 8 years ago. But after a year or two, the effects of the PPIs were non-existent. So my symptoms have really affected my lifestyle. It meant I couldn't enjoy parties, going out, stag do's, weddings, all the things I used to enjoy doing. It also meant that I had to change my diet. So I started eliminating things like alcohol, citrus, caffeine, and tomatoes, the usual suspects when it comes to acid reflux. So I got in touch with my GP directly after I found out about the LINX procedure and the potential benefits of the procedure and what it could do for me. She then referred me to RefluxUK and Nick Boyle. I think he's done the most procedures of this particular device in the UK, which was a real positive for me. I came down to the spa in Tunbridge Wells and had some diagnostic tests. Nick recommended that I take some pills that would encourage the esophagus to work a bit better, work a bit harder. These seem to have an effect and actually work. My scores went up to a level that was on the cusp, but enough that I could go ahead with the LINX procedure. So the process from having my final consultation with Nick to being here waiting for my operation has just been a week, so very short time.
I don't propose to go through everything again because we've been through, we've been through everything in detail. But let's just talk about a couple of things. So, firstly, in terms of the operation itself, as you know, there'll be 4 little holes in your tummy. We'll repair the hiatus hernia and then put the LINX device in. We'll measure the esophagus, so everybody is slightly different size, so we'll tailor the size of the implant for you.
Okay.
All right. So the operation will take about 30 to 45 minutes, and the plan will be that once you've woken up, recover from the anaesthetic, you'll go home later on this evening. So in terms of recovery, you'll be up and around walking straight away. Most people find that within a few days you're more or less back to normal, and certainly by a week to 10 days you should be absolutely fine. But I probably want you to avoid heavy lifting and heavy physical exercise for about 6 weeks or so, just to let the repair settle down.
Okay.
I think one thing I would emphasise, and I emphasise this to everybody, but I sometimes sound like a broken record, is that you will have to wait probably 6 months or so to judge the final outcome.
Mm-hmm. Okay.
But having said that, most people will find that those symptoms, that regurgitation problem, that acid heartburn, that will probably just go away straight away.
Okay.
So hopefully,
the trigger foods like
with
coffee and tomatoes.
well, hopefully the whole point of the operation is to get you back to normal,
Yeah.
so you'll be able to have a beer and a cappuccino without any problem.
That's fine. So after the operation, I was coming around from the anaesthetic. I had a bit of a sharp pain in my shoulders, but apparently that's to be expected with the air. It's still a bit painful now, the morning after, but certainly a lot less. My stomach, there's 4 small incisions, and actually the pain from that has been really nothing at all. There's just a slight soreness. So I came around from the surgery fairly late. Wasn't feeling enormously hungry, but I actually managed later on in the evening to eat a quarter of a sandwich, and that all went down well, which was surprising for me, but also positive, and managed a few smaller bits as well. So when I came out of surgery and was being brought back to the room, Mr. Boyle came to see me. He had previously spoken to my wife and passed on the news that the surgery all went well. I actually had a larger hiatus hernia that he was surprised with. I had an endoscopy a few months ago and it showed a small hiatus hernia, but it gradually got worse and bigger. So he managed to fix that and stitch it up. And so hopefully that will help with the symptoms. I'd certainly recommend the procedure or going to see a specialist like Nick if you're suffering from many symptoms like I have been for the last few years. I think you can normalise it. If you're living with it day in, day out, you kind of get used to the symptoms. It's not a normal life and it's not pleasant. So yeah, definitely worth it. Nick's fantastic. He's very approachable, but also he tells you exactly what you want to hear. He has that confidence that he knows what he's doing, and that he can help you. He genuinely wants to help people that are suffering.